In our first video, we shared with you an overview of the new heart and vascular program at the hospital, and how it will introduce a more comprehensive cardiovascular program, combining the expertise of the talented physicians and clinical team with the capabilities to provide a full spectrum of cardiovascular medicine, all under one roof, close to home. Now we want to share the importance of a new service, electrophysiology, and electrophysiology studies. If you haven't seen the first video, visit our website at tvrhfoundation.org or call the Foundation office at 352-751-8871.
Well, I came needing help because I was in cardiac arrest, and my doctor told me, he said, "You've got to see a cardiologist immediately when you get back to Florida." So I did. I called the doctor, and I was told to come here, and they took care of me from the start. They questioned me, they copied all my information, and they were very helpful in helping me make a decision on which was the next step. And from then, from the last 2 years, I went through lots of traumatic kinds of things, from heart flutter, and I had to have a shock to bring my heart back into sync, and that was done here at the hospital, and they treated me as if I were their best friend. I couldn't ask for any kinder treatment, and from the doctor's office, when that all occurred, they put me in a wheelchair and wheeled me over to the hospital, to the emergency room. I didn't realize I was in that much stress, because I didn't feel the flutter at all. And then from there, I went to being a little more healthy, getting meds and so on. But then it started again. I was short-breathed and couldn't walk, tired all the time. And then it was found that I had another problem, that I had a vein or an artery that was needing help. And so they made a recommendation that the valve be replaced. And so then I had that done. And now I feel like I'm a free woman. I can breathe and I can walk, and I'm happy. And I think my cardio rehab will be here at the hospital. This was just in the last 6 weeks that I had the surgery. So I hope, and I was told that this is the best place for the cardio rehab, so I'm going to come back here.
We perform thousands of procedures every year. And within that realm, there's pacemakers, defibrillators, electrophysiology, coronary work. And so we have a very robust specialty and excellent, superb, top-notch selection of medical staff that helps us in taking care of our patients and serving our community.
Cardiac care is essentially, it's very important to have it in a timely manner, and that is true for electrophysiology, which is kind of where we deal with arrhythmias in the heart. It needs to be done in a very timely manner and in a highly skilled manner. And new things that we implemented is floorless ablation. Ablation is where we kind of try to burn away arrhythmias in your heart or freeze it away. And we used to always only know where we are in your heart with using X-rays. Nowadays we can use GPS and ultrasound, a combination of those. Same as GPS can locate you where you're in the world. If you go the other way, then you can even say we can, so in a microcosmos, where we are with the catheter in your heart, so that we don't have to radiate you as a patient as well as the doctor who is doing the procedures, and hundreds of them a year, doesn't get unnecessarily radiated.
This new center will also have electrophysiologic study capability, and we'll have new advanced features. We'll be able to do atrial fibrillation ablation, we'll be able to do ventricular tachycardia ablation, and we'll be able to employ newer technologies that include newer 3D mapping techniques, Also new catheters, which we can use cryoballoon ablation. We have the catheter radiofrequency ablation. And then coming up in the horizon is pulse field ablation, which hopefully once the research study is over and we'll get more newer data for that, that looks promising to treat and cure AFib. We can also treat general arrhythmias like supraventricular tachycardias or atrial arrhythmias and focal ventricular arrhythmias. So this would be very important to the population here because a lot of arrhythmias occur in the elderly. Atrial fibrillation is the most common, and now providing this technology here locally, patients will not have to travel, and it will make it a little bit more accessible. And with the expertise and surgical backup, we should be able to provide the care the community needs.
I cannot thank our community partners enough for the impact of their gift on every life that we save.
In closing, I'd like to thank you on behalf of the Foundation for all the support you have provided since March of 2013, the inception of our foundation. Because of your support, our businesses, which consist of the Hospital Gift Gallery, Hospital Cafe, and the Thrift Shop, continue to increase revenue. Our scholarship program has reached over 100 students, and our endowment fund exceeds $400,000. And the room naming program has over 100 sponsors. Because of this, we've been able to provide over $10 million to the hospital. Now we embark on a new campaign to fund the Philips scanner. Please join us in this new adventure. Our goal is to raise $1.4 million. And a special thanks to a very generous donor who has pledged a $75,000 matching gift for any individual, business, organization, or club that makes a financial contribution for the first time to our foundation. Will you consider helping us as we save and change lives? Thank you for your time.